Greetings. My name is Rick Wickstrom. I serve as the president of the Occupational Health Special Interest Group in the Academy of Orthopedic Physical Therapy. And I'm here today to talk about a motion that was born in the occupational health SIG, but is applicable across all practice settings as a motion to move our profession forward. I'm going to share a brief slide deck with you and to provide some background information and better understanding about the intent of our motion. The title of our motion is RC-11-22, Access to Physical Therapists as Entry Point Practitioners for Activity Participation, Wellness, Health, and Disability Determination. The two individuals that I've worked with most closely on this motion are the Vice President of our Occupational Health SIG, Steve Allison, who's a practitioner like myself in Louisiana. And Steve has been a great mentor to me to become a DOT certified medical examiner. And also with James Spencer, who's a very inclusive leader of the Academy of Orthopedic Physical Therapy. And James is the practice chair and the chief delegate and the incoming vice president. So we're all excited about this motion and what it can do to create opportunities for our profession. I've been long a fan of the military model. For 50 years, physical therapists in a military setting have prescribed medicines, referred for imaging, restricted soldiers to appropriate activities. And unfortunately, we have been slow to take the evidence that's come out of the military model and make entry point care a consistent reality for physical therapists. So our purpose is to clarify the expertise and role of physical therapists in entry point care for activity participation, wellness, movement health, and disability management and determination. We want to inspire advocacy by members to remove barriers in all areas of PT practice. And some of the low-hanging fruit is not regulatory barriers, but it's our own image of our profession and how we present our abilities to do critical aspects of care, such as making a differential diagnosis. We want to drive improvements to APTA core documents and also to the Federal Model Practice Act and regulations that influence entry point care. In my area of specialization, occupational health, our goal is to become the primary treating practitioner of a workers' comp claimant. And to do so, we have to have language that speaks to our ability to diagnose causality and determine disability for work-related claims conditions. And I'm so proud that North Dakota has accomplished this as the first state in 2022, and we want to build on their accomplishment. In my state of Ohio, the athletic trainers, who I respect, modified their definition of athletic training to include language about establishing the cause and nature of a patient's injury, emerging condition, or functional impairment. And this language is important to position the athletic trainers. It's also important for physical therapists to position us at the sidelines of athletic events and also in other forums such as workers' compensation plans. One of my challenges and concerns is that youth sports organizations oftentimes fail to include physical therapists in their forms. And these are very simple exams that are intended to promote safe participation and not to screen people out of participation in healthy physical activity. In the medical eligibility form, they note that the individual that can perform the exams are MDs, DOs, doctors of chiropractor, who I feel that we're equally qualified as physical therapists to do this, nurse practitioners and physical therapy assistants. And it's truly a cancer and a black mark on our profession that we're not listed on this form, because it creates a misperception to youth and their parents very early on that physical therapists are not entry point providers. Even a national organization such as the Special Olympics, and APTA is a partner with the Special Olympics Committee, has a notation on their form that the athletic medical form, the physical exam, must be completed by a licensed medical provider qualified to conduct exams and prescribe medications. And I would argue that the prescriptive authority to prescribe medications should not be extended as a requirement to do other kinds of prescriptions that physical therapists can do that relate to activity participation. Now, I often ask myself, well, why is the root cause of the sports organization barriers? And it's because the guidelines for pre-participation physical evaluations are completely dominated by medical societies. And these are consensus-based documents that their own societies acknowledge they're not evidence-based. And the survey information indicates that only about 2 out of every 20,000 exams actually had major findings that limited sports participation. And 26% of physicians that are surveyed said they don't even do a physical exam to provide a clearance for youth sports participation. So this is a real important opportunity for us to, and it's unfortunate that we don't have a seat at the table in developing these guidelines, and we need to develop guidelines of our own that will strengthen our role in this important activity clearance process. We've set important precedent in 6 states that physical therapists are qualified to perform Department of Transportation physical exams of commercial vehicle drivers. And this is a public safety issue, and it provides compelling evidence that we're qualified to perform simpler sports participation exams and other activities such as prescribing handicapped placards and whatnot that utilize our unique skills and identity as physical therapists. Chiropractors are authorized in all the states, and I am hopeful that our motion will motivate physical therapists in all 50 states to become certified medical examiners. The medical examiner duties in a physical exam for a DOT physical are utilize skills that are routinely performed by physical therapists in various specialty practice areas. The cardiovascular specialists routinely check and listen to hearts and lungs. The pelvic health specialists routinely palpate the abdomen for hernias and whatnot. And these are all learnable skills that can be advanced through the mandatory continuing education requirements for taking the CME exam, as well as just shadowing other health practitioners, such as nurse practitioners, to build confidence in skills such as listening, palpating the chest, and whatnot. Now, in becoming qualified for these simpler exams and as a routine basis across all states, we're better positioning physical therapists to be acknowledged by Social Security Administration that it's within our scope of practice to provide opinions to SSI about the severity of physical limitations and how those physical limitations interfere with patients' and clients' abilities to perform work activities. This is a big need. Social Security disability recipients that we serve in our clinics, oftentimes they need examinations by knowledgeable practitioners such as physical therapists to support or justify their need for benefits. And unfortunately, we have not been qualified by SSA because they're making a presumption that the licensing requirements for physical therapists are not at a similar level of consistency or rigor in education, training, education, and scope of practice. So we have work to do in this area, but but establishing a stronger basis in sports and DOT physicals and workers' compensation entry point care will do nothing but strengthen our eligibility and recognition for doing this. Our motion will be replacing an existing motion for disability evaluation and determination. We've incorporated basically the same language, but we've further added other language. And this motion began with a simple motion that says physical therapists are qualified to justify the need for handicapped or disability parking placards. So as I look at our motion language, it is bold in asserting and not sugarcoating that we provide a broad range of services that include diagnosis and prognosis and referral to other healthcare practitioners, and that we include important language in our motion that we identify the cause and or nature of injuries and symptoms and conditions and impairments participation restrictions and environmental barriers and facilitators. And we're not sugarcoating that we perform a diagnosis and that we utilize relevant diagnostic tests and measures and use classification labels that could come from the ICF or it could come from the ICD coding structure by the World Health Organization. So our unique spot as professionals is to determine functioning and the extent of disability and to influence improvements in that area. And we do this with our own areas of expertise regarding either prescriptive authority or to recommend appropriate physical activities and accommodations and adaptive and assistive technology and diagnostic tests and other interventions that optimize functioning and participation. So I hope you will join me in endorsing and voting for this motion. We're still because it's a key outward-facing message that we need to be all more consistent about speaking to as we interact with organizations that are making judgments about our profession without really having a good understanding of our full scope of expertise.